Good morning everyone. Myself Shubham Jain, owner of Ayurvedic channel The Indian Pathy, welcomes you all in today's webinar series of AyuTip. Our resource person and our guest speaker, Dr. Sangameshwar sir is with us. I wish to welcome you here. He is a BMS, MD and PhD scholar and assistant professor in Department of Panchakarma in SS Ayurvedic Medical College, Haveri, Karnataka. We are grateful for your presence and are very thankful that you could make time for our students out of your busy schedule. I hope today's webinar will be good and informative to all of us. So continuing the fourth day of our webinar series with our fourth topic, that is Virechanakarma with pathyadi lep in different skin disorders case studies. Before starting, I would like to introduce some rules to the participants. Please keep your mic off during the presentation. If you have queries, you can put your questions in the chat box. It will be discussed later upon according to the time. So, without wasting much time, I will request Dr. Sangameshwar sir to start our today's webinar. Thank you and over to you, sir.
Sir, good morning to all. Good morning to everyone. Is it audible to everyone, sir?
Yes, sir, it is audible.
Am I audible to everyone?
Yes, sir, you are audible.
Yes, without wasting much of the time, today I am going to enter my fourth webinar presentation, that is Virechanakarma with pathyadi in my clinical study, in my clinical review. And today is the fourth seminar which I am going to do the fourth presentation in this on behalf of these organizers. My topic today is the Virechanakarma with pathyadi lepa in my clinical studies. And with all these informations, with my all these clinical evaluations and clinical studies, I am going to start the topic. And now I am going to start sharing my screen. Om Shri Dhanvantaraye Namaha. Good morning to all. Virechanakarma followed by pathyadi lepa in different skin disorders. Case studies. Nirupti and Veda, all these are the whatever visualization is there on the screen are the contents of today's presentation, webinar presentation. Nirupti and Veda, indications and contraindications of Virechanakarma, Virechanakarma procedure, speciality and advantages of Virechanakarma, pathyadi lepa, case studies, discussion and conclusion, and references. Before the introduction, I am going to speak about the Virechanakarma. In Ayurveda, all the skin diseases are explained under the single broad head called Kushtaroga, in which morbid doshas produces a discoloration of skin due to accumulation or dushti of the doshas on the skin with the Tridosha Vikriti or Pitta with the discoloration of the skin will be there. In all these skins comes under the single heading Kushtaroga in Ayurveda. Skin disease does not only affect the physical disturbance, but it disturbs the mental status also. Kushtaroga is considered as a Rakta Pradoshija Vikara, means here the Rakta and the Tridoshas, mainly Vata, Pitta, Kapha, Pitta dominant, Dushti will be there. Rakta Pradoshija Vikaras and Virechana is the choice of treatment chosen as per the classical evidence or reference. The Pitta Dushti, for Pitta and Rakta Dushti, Virechana is the line of treatment. Panchakarma is getting globally attention nowadays. The Virechana is one among the procedure which is actively used in Ayurveda by Ayurveda fraternities, everyone. 4 different types of Virechana are Andromana, Samsramana, Vedana, Virechana, and which are mentioned in our classics. Controlled purgation is used to flush out the body toxins like liver toxins, colon toxins. Virechana has 3 steps like Karma, Pradhanakarma, and Paschatkarma. Post-operative cares. Virechana is results. If all these steps all these procedure are the Virechanakarma followed properly. After a Shodhana, pathyadi Lepa is used as Bahya Chikitsa for local application. Pathyadi Lepa is having a Vrana Shodhana, Vrana Ropana, Vranahara and Kushtahara property. Hence, Virechanakarma followed by pathyadi Lepa is taken in clinical study, in my clinical study. Because in modern medicine there are so many applications are advised in day-to-day life as we are practicing in general practices as well as in classical practices. But we are looking into an era. There are so many applications, ointment ranges, lotions, and these sprays they are being using for an locally skin for the curation and cures of skin diseases. Hence, in my view, the pathyadi Lepa is also a best application as I have tried in according to my clinical study, as I am going to show you with my clinical cases today. But Virechana is a Shodhana procedure which I have been chosen here, and with the pathyadi Lepa evaluation, with the Virechanakarma effectiveness, I have been here including the diseases of skin diseases, Kushtaroga diseases. And I want to have a glance on Virechanakarma and after the pathyadi Lepa, then after I am going to enter into my clinical study cases. Etymology. The word Virechana is from the root Rich Dhatu, Vi Upasada, Nich, Lit Pratyaya, gains, giving the Visheshana Rechetiti. Rechana is derived from root word Richar Dhatu. Lit Pratyaya means Samparchana means combination. From Adobhaga is known as Virechana. Meaning, word Adobhaga implies here is Buddhamarga. Through Buddhamarga, there will be an expulsion of the dosha, expulsion of the morbid doshas which are present, expulsion of the dushti, expulsion of certain toxins or doshas. Vireko, Mukapitam, Buddhamargenanta, Pittasya doshasya nissaranam, Pittasya paramaushadam. Means, Virechana is a procedure in which orally administered drug acts on internally situated doshas, specifically on Pitta dosha, expels them out of the body through anal route. Through anal route, the visarana of doshas will be there in this procedure, in this Virechana procedure. Classification of Virechana. The Virechana is classified in different ways according to their mode of action, origin, parts used. The Dravya parts, whatever they are used in the procedure of Virechana, the classification is done. First one, according to the origin, the animal origin, for an example, Mutra, Godugdha, Takra, these are all the animal origin products which have been, according to the origin, it has been differentiated, classified. And plant origin, Shankini, Vidanga, Danti, Sweta, these are all the plant origins which have been used as in Virechana classifications. And according to the parts used, Moolini, part of the certain drug is used in the Virechana procedure. And the types have been classified. And the Virechana drugs means if the drug is an Mrudu Virechaka, it has been classified under the Mrudu Virechana procedure. And if the Virechaka, it is classified under Madhyama Virechana Dravya. And if it is Tikshna, hence it is classified under the Tikshna Virechana Dravya. These are all the types. And next is the indication. Where and all the Virechana indicated, in which are all the doshas, in which are all the diseases, according to the classical references, Charaka Siddhisthana, Shutrasthana, Chikitsasthana, in Ashtanga Sutrasthana, it has been classified and explained, and it has the references as you are seeing on the screen. In case of Kushta, in case of Jara, where the Pitta dominance is there. In case of Meha, in case of Urdhvagata Rakta Pitta, where in case of Urdhvagata Rakta Pitta, there will be a Virechana. In case of an Adhogata Rakta Pitta, Omana is indicated. In case of Bagandhara, Udara, Arsha, Brahmana, and the Pliha, Gulma diseases, and Arbuda, and Galaganda, and next the Granthi, Visuchika, all Dhata, and Krimi Koshta, Visarpa, the dominant doshas of Pitta dominant diseases. In case of all the Pitta dominant diseases, like Panduroga, Shirashula, Parshashula, and Udavarta, Netra Daha diseases, and the Asyak Daha, Hriddaha, Venga, Nilika, Netra Srava, in Nasika Srava, in Asyava, in Halimaka, in Shwasa, Kasa, Kamala, Apachi, Apasmara, Unmada, Vatarakta, in Yeri doshas, in Rek doshas, in Timira, in Avapidaka, in Avapaka, in the Chardi, in case of the Chvaya to Udara, in case of an Vispota, Visarpa, and all, the Virechana is indicated. Virechana is indicated. And next is the contraindication of Virechanakarma, where the Avirechastu Subhagaha, Shataguda, Muktanala, Adhobhaga Rakta Pitta, the Vilangita, Durbalindriya, Alpagni, Niruda Kama, Divyagra, Ajena Nama, Jwari, Madateya Admata, in Subhaga, in Ksataguda, in Muktanala, and Adhogata Rakta Pitta, and Vilangita, in Durbalindriya, Alpagni, Niruda, Kamadi, Vyagra, and Navajwari, in Madateya case, in Atma, Atisnigda, Atiruksha, in Dharana Koshta, in Garbini. These are all the contraindications of karma. And next is, I am with a brief introduction and the indications and contraindications, how the Virechana is going to act, how the mode of action on the intestine, on the patient, how it is going to act, and how the Drava, Virechana Dravya, is going to act. on administration of an aushadhi to an patient. After the pre and procedures and the purva karma has been finished, the administration of an aushadhi we are going to do. Absorption of the dravya, whatever we have given, the absorbed virya will be there. Certain virya will be there of certain dravyas. It is get absorbed in the stomach. It is get absorbed in the amashaya, and it circulates over the body to micro and macro channels. Due to that Vyavayi Vikasi gunas, Vyavayi quick absorption, Vikasi Dhatu, Shaitilya Karma. It gets into Ushna, Vishandana and Sanghata dosha. Means doshas will liquefy there. When the doshas are bring back into a kosta, there the Vishandana Sangatana, the liquefaction of doshas happens there. Due to Tikshna gunas, the Vichandanavanti breaks down into a mala and a microform, and Sukshma reaches into micro channels. Of toxins will be there in the certain in Papashaya, in Amashaya, and the Anu Prana Bhava microfied in a it becomes into a microfied. Through that, there will be a disintegration of the certain doshas by the Virya and Vibhaka, and through Prabhava, the Prithvi and Jala constitutes presence of Saraguna. Due to Saraguna, the Virechana Vedas will happen. These are all the mode of action in the Virechanakarma with our given administered drug, Aushadhi. These are all the as showing in the figure in the screen. You are looking at the mode of action with a beautiful chart here. And next is, whatever the thing will be actually going on, the modern explanation on possible action of Virechanakarma. From the modern point of view, we can say that the karma has been induced mild inflammation mainly by Upanaha or the Virechana drugs are quite irritant to the stomach and to intestinal mucosa, which causes inflammation, which may lead to an inflammation and irritation to a mucous layer of the intestine, which affects the villi or which affects the mucous layer of an intestine. Due to this permeability of the membrane changes, and those substances come out due to change the permeability, which cannot come out in normal condition. The gross sign of an inflammations are redness, heat, swelling, and pain, and loss of functions. These signs occupies due to following changes at microscopic level. These are all the things actually going to physical and changes going to happen in the intestine. When whatever we are indicating in this is in the patient according to the dosha predominance. And next, whatever the methodology I have been chosen in my patients in case of kushta, in case of skin disorders, first 3 days, 2 to 3 days, till the treatment in some of the cases 5 days or so, till the Nirama Lakshana is seen, Amapachana is done. And next, with the start of the Snehapana, whatever depends on the dosha Lakshanas, the Snehana or the Sneha Dravya is chosen. Sneha Grata, whatever we are going to choose, depends on the dosha, depends on the dosha predominance. We are going to choose the Grata here. Means for Snehapana. Snehapana is done in an Arohana Snehapana with the Shodhananga Snehapana. We are doing, first we are going to start with 30 ml of Sneha for 3 to 7 days, depends on the Kosta, Agni and the Doshas. Snehapana, till the Snigdha Lakshanas are seen, the Snehapana is done. And next 3 days after the Snigdha Lakshanas or Samyak Snigdha Lakshanas are seen in an Rogi, Vishramakala is for 3 days. Abhyanga and Svedana is done. And for 3 days, Vishramakala means Abhyanga and Svedana. After that, a patient is asked to admit in an hospital before a day, and he is eligible to have a Virechana procedure with all the examination, with the restricted times and with all the restrictory aspects, whatever the Virechana procedure is did, that has been done, and the patient is admitted for 1 day and Virechana is done. Samhitas at 3 to 7 days as per Koshta Shuddhi, depends on the Koshta, depends on the Agni, depends on the Dosha, the Samhitas is fixed. And after that, in the post period after an Virechanakarma, the Lepa is advised accordingly, depends on processes, skin vessels, and follow whichever and is on first day and 10th day after completion of an Virechanakarma, and after I am going to start the Lepa advice, and after the for 1 week or 10 days or 20 days up to 40 days, the total duration whatever I am taking depends on the days, depends on the diseases, varies. Here I have given us some sort of a methodology whichever I have been explained here. And next is review of drug. Whatever the drugs I am going to choose here is, in Ayurveda, the success Chikitsa depends upon the totally upon Chikitsa Chatushpada. Among 4 basic factors of treatment, dravya is being avoided as second place. Hence, indication of Virechana is well explained by Acharya Charaka in Government of Pushta for Shodhana therapy. And as pathyadi lepa is also taken for study, which has been explained by in Vaisheshya Ratnavali and Yoga Ratnakara as Kushtahara lepa. You may go through Indian classical reference that it has got a good reference, good result-oriented lepa that is comes in Kushtahara lepa, the Vaisheshya Ratnavali and Yoga Ratnakara reference. So, present study it has been carried out to evaluate the Virechanakarma with pathyadi lepa in managing the skin diseases. And drugs, whichever I am going to choose for Ampachana, Trikatachurna or the Chitrakadivati for Ampachana for 3 to 5 days till the Nirama Lakshana is seen, and the Sneha, whichever I am going to choose here is the Panchtitta Gugurata or Mahatittaka or the Kalyanaka or whatever the depends on the diseases I am going to choose it. And Murchita Tilathaila for Abhyanga is used, and Triurat Leha is used for Virechana. Pathyadi lepa as a lepa with the Shamana Ushadis for application I used to giving for my clinical studies to my patients in skin disorders. And next is the Purvakarma. Purvakarma here is the first Purvakarma includes the Sambara Sangraha, means collection of the necessary materials. The collection of the necessary material here is the whatever the procedures are needed in the Purvakarma procedures, whatever needed, the procedure, the Pachana Aushadhi here for an advise the patient with all the patient is restricted for an to intake of an hot water, and all the ingredients are the materials needed for Purvakarma is taken and made into an available. And next, Athura Parisham.
Medical examinations, BP, pulse saturation, and the patient is often non-diabetic or hypertensive or known case of an IHD. It is been evaluated and the history has been taken with a need case sheet is made. And Athura Siddhata, preparation of a patient. Patient should be explained about the Virechanakarma and about the Virechana procedure. The patient will be advised,
and to such a so that he or she should be having a restricted diets and regimens, and the dose regulation, about the snehapana, about the diets and regimens, about the restriction, about the intake of food, and the whatever the restrictions about the Vedas, and it should be explained. And about the dose fixation, about the snehapana, with a neat manner, about the Virechanakarma, the Purva Karma, in Purva Karma, it is all explained to a patient. It is all explained to Rogi. And next is Pradhana Karma. Major Pradhana Karma is a major procedure comes in Virechana Karma. Virechana Yoga Prayoga means whatever the drug we are going to choose. As I have been explained, if the Madhyama Roga Marga or the Madhyama Roga doshas are there, hence certainly depends on the Virechana drug, we may choose or change the administration of an Virechana drug. Depends on its effectiveness, depends on the dosha, depends on the kosta, depends on the agni. The Virechana Prayoga or the administration of Virechana drug is chosen. And Atura Paricharya and Nirikshana, observation and care of an patient. After an indication, after the dosage of an Virechana is given, Virechana drug is given, Vega Nirikshana is done. How much Vega and Upavegas has been passed, and how the patient is getting, how many Vegas, at what time interval patient is getting the Vegas, we should have a study about it. And what will be the order, arsenal, or the whatever the presence of an Vega, or the how the stool is going to patient is passing, we should observe, we should ask the patient and know about the Vega Nirikshana. And last is, in part, the Pradhana Karma is Virechana Vyapats and Chikitsa. We should observe the patient for Samyak, Ayoga and Atiyoga Lakshanas in Pradhana Karma. If the patient may get the Samyak Yogas, Samyak Vegas, he may get. Or in often cases, Ayoga Lakshanas are also seen. Then what we should do? And Atiyoga Lakshanas are also seen, may be seen. In such a cases, how and all the Virechana Vyapas and Chikitsa should be maintained, should know about it. And these are all the aspects comes in Pradhana Karma. Paschat Karma means the Parihara, behavioral dietary restrictions. What are all the dietary restrictions of Parihara Karma is, we should be seen in Paschat Karma. And Sansarjana Karma. After the Virechana Karma, with behavioral and dietary restrictions, the dietetic regimen is given to. For an example, Manda, Peya, Vilepi, and the drugs are the whatever the food should be changed, how the food be changed after a procedure, it should be taught, the schedule should be given to a patient. And Anna Karma Vichar, if we are planning to, that's what I have been telling, if we are giving to switching into another treatment for an basti, or the lepas, or the ornaments, or the shamana aushadhis, if we are planning, we should think of it and we should advise the patient. These are all the procedures which have been explained in briefly about the Virechana Karma. And next, I am going to show you here is the criteria. The Shuddhi. Shuddhi is Vegiki, Maniki, Antiki. A Pravar Shuddhi is 30 Vegas, Madhyama Shuddhi is 20 Vegas, and our Shuddhi is 10 Vegas. And in case of Maniki, 4 Prastha, 3 Prastha, and 2 Prasthas are differentiated. Shroto Vishuddhi Indra Sampra Sadau Lagutvam Urjo Agni Anamayatvam Praptischa Bit Pitta Kapanilanam Samyak Virittasya Bhavet Kramen. Means the Shrota Vishuddhi happens here. Indriya Samprada happens here. the Jadata relieves, Lahut comes in the body. Urjo Agni Pradipana comes here. And with Kapha, Anila means Vata, relieves, Viriktasya Bhavai, means Virechanakan, all the Tridoshas, Virechanakan, toxins, dravyas, Virechanakan, doshas, all the doshas, predominant doshas, are relieved. Hence, the Laigiki Shuddhi Lakshana or the Samyak Virechana Lakshanas has been explained. Samyak Lakshanas are considered under Laigiki criteria. Hence, it has been explained according to the Vedas and the Maniki, Vegiki and Antiki Lakshana Shuddhis are explained. And next is, if the Atiyoga happens, what are all the aspects are the chances of an diseases are the, here it has been explained. Atiyoga Lakshanas, Parikartika, Jivadanam, Vibramsha and Budabramsha, Samjna Vibramsha. In Ayoga Lakshanas, Admana, Srava, Hridgraha, Gatragraha, Kandavadi Vibramsha, Upadrava, Klama, and all the aspects are the diseases happens due to Ayoga and Atiyogas. And next is application of pathyadi lepa. When and how it is applied. On making the paste of such a lepa, the pathyadi lepa is applied over the lesion Ardha Mahisha Churna Pramana 2 times a day, that is in the morning, in the evening. After Rasa Samsarjana Karma, it has been applied. Procedure will be followed as per classics depending on the advice, according to the advice of a patient, according to the advice of a doctor. In the patients depends on the dosha and pramana to a lesion or to skin affected part. The pathyadi lepa is advised and given. And assessment will be done on first day before treatment, how the lesions are, disease is there, and next is after 10th and 20th and 30th days after treatment. And next is, what is the major constituent of an pathyadi lepa? Which have been chosen? Why the pathyadi lepa has been chosen? You may see here, all the kushtahara dravyas, patya, terminila chavala, kashaya pradana pancharasa is a rasa predominance here. Means lahu ruksha, ushna, madura, tridoshahara. Tridoshahara properties it is having. Karanja, one of the kapavata shamaka dravya, which is an ushnavirya, and it is a katu vipaka. All the katu vipakas are there, and ushnaviryatmaka dravyas are. Haridra is a good antiseptic here, which acts as an antiseptic here, and the sarshapa, the tikshna ruksha property it is having. Kapavata shamaka it is. All the drugs, almost all the drugs are Kapavata Shamaka property it is having, and also Pushtagna property. Haridra is a major drug of the Pushtagna property it is having. The major ingredient here is Patya, Karanja, Sarshapa, Haridra, and next is Bakuchi. It's a very effective drug which is also a Pushtagna dravya, which acts the, you may see a Bakuchi separate, the Bakuchi lepa is done, and Bakuchi lepa is used in so much of the leukoderma cases. In the Shvitra cases, Bakuchi lepa, which is a very, this is a little bit erosive drug, and it's an which leads to rashes, which may leads to a vrana, and it is having a healing property also. It's an Pushtagna dravya. It's an Vata Kaphamaka. It's also a Vata Kapashama. And sound the Saindhavana here is which affects the skin, which disintegrates the drug properties on the skin layer. On the skin layer, the Saindhavana which disintegrates, which gives them the erosive effect. The Bakuchi and Saindhava, which are having a very much effective properties with the Vidanga and Gomutra, which are Lekniya Gunas, which are all the Kapavata Shamaka Guna, which are having a Kushtagna and Krimigna properties, Vidanga and all. Likewise, major constituent of our Pathyadi lepa is Patya, Karanja, Sarshapa, Haridra, Bakuchi, Saindhavalagana, Vidanga, Gomutra. These are all the drugs ingredient of pathyadi lepa. And next I am going to enter into my case studies. Some of the case studies whichever in different skin diseases, whichever I have been having a clinical study, case studies, you may go through this. First one is Kushta, case of Kushta. It has been a 62 years male, elderly man who has been suffering from the Kushta. He has been undergone the Virechana procedure, and after an Virechanakarma, we are showing the Lepa application here. The pathyadi Lepa you may see in an hand, in a bowl. It has been made into a paste. It will be not so liquid, not so solid also. With a medium paste it is made, and it is being applied to a feet. And you may see the lesion has been reducing. The normalcy of a skin is coming in an upper lesion. You may go through, you may see on the screen that the skin is developing and the lesion is reducing here. And next case, it's a beautiful case. It's a patient of a 24 years male of nearby my place. He has been taken treatment in Bengaluru. He has been got admitted, and he has been done Virechana for 2 times there in 3 months. He has not get cured, but he has been admitted in my hospital with a case of an Kitiba Kushta. Has been Shodhana done. He has taken up to 280 ml of the Upanaha as a Snehapana, and systemic Virechanakarma has been done. After an Virechanakarma, after an Samhitas, we have been advised still more. There was a lesions, and there is a small sort of a lesions, and the Pasi signs were there, and so hence the pathyadi lepa was given as an application to all our body, and we applied, and we have got the result. Before and after treatment, you may see the result in Kitiba Kushta, a pathyadi lepa. And next is, it's also case of an Kushta. You may see in a case, there is a graph also, and there is a significant reduction in the PASI severity index scoring of 30 patients. We have been studied before that. And next, you may see in the figure, a hand is showing where the skin lesions are there, where the Kushta lesions, psoriatic lesions are there, who has been get cured, and the lesions has been reduced in second figure. There is no lesions, or there is no PASI severity signs are there. You may see in the figure. It has been also a Shodhana done with the Virechana, with the Tirutleha, the Mahapitta Grata was been tried with here, and Shodhana was done. Patient after Virechana, pathyadi lepa was given to application for local application with Shamana studies. And next year also a lesion, same lesion, it was on feet, and you may see the pathyadi lepa applied. How the skin lesion has been reduced in its size, overall size it is reducing. You may see the upper lesion has been gone. It has been disappeared, and the lower lesion little bit it is also in shape and size it has reduced. And next, a case of Virechana which has Virechan, which has been given a pathyadi lepa application for pathyadi lepa application, which has been reduced. There is a discoloration you may see in the foot where the itching or the lesion or the dryness or the oozing has been reduced completely after a week. With the only Shamana Shadi, it has been reduced with the application of pathyadi lepa here. And next, case of an Ekakushta, a schematic Virechana procedure has been done. Within the Panchpitta Kukulata was given and Shodhana was done after an Virechana. The skin lesions, there is a magnificent lesions, reduction in the lesions is seen. A case of Ekakushta, which has been taken treatment in our hospital, after 15 days, there is a reduction in the case. You may see the lesions comparatively in the first figure to second figure and third figure. You may see in the case of Ekakushta. And next, it's a Dadru case. Infected fungal infection was there. In that also, there is the pathyadi lepa was tried and it has been given as a lepa with the Shamnaushadhi. Kushtahara lepa, pathyadi lepa has been given with the Shamnaushadhis. It has been treated. There is a reduction. Within an only week, it has got a glance here. You may see in the photos before and after treatment. And in case of Shutra, as I have been told, explained here before this, there is a Bakuchi, which has a skin Kushtahara lepa, which acts as a Krimigna here, and which has a Kushtagna dravya here, which acts as the depigmentation, which gives rise to a pigmentation of a skin, which leads to a pigmentation. There is a grasping, reduction, change in the skin color. The Switra lesion has been reduced. You may see in the figure. The Switra case, which has been tried with after Virechana, we have been tried with an pathyadi lepa. There is the enhancing which has been given. You may see in the before and after photo the reduction of lesion of Switra here. With the oral medicines, it has been reduced. And next, the Virechana case, 57 years male, who has been tried with all the corticosteroidal alignment side treatments and corticosteroidal line of oral medicines. He was actually a pharmacist. He has taken all the medicines. But after an admission, there was a complete cure was not there. You may see in the figure, still there was lesions on the forehead. The Virechana procedure has been done. For 12 days he was admitted. After an Ampachana, he has came into our hospital and he had oral medicines. With the oral Mahatikta Kashaya or the Dharma Clean or the Dandak Rasayana and the Arabhadadi Kashaya has been given. And with that, Shamanoshadhi, before the Virechana, he was given, but he was not cured. Hence, after that, he was admitted for Virechana and we have given the pathyadi lepa for application for him also. It has been cured and it has got a good result in Virechana also. And you may see the lesion in the hand. Another case of Kushta, the lesion how it has been reduced. You may see in an arm from first to last figure, before and after treatment. And its case of Venga, which has been applied a case within our pathyadi lepa, it has been given to whom. And before this, I have been shown this figure also. Another 2-3 settings of an Rakta Mokshana was also done to this case. And after an application of Lepa, we have got the result. We have got the Venga case. We have got the result. You may see in the before after treatment. And next case of Switra, you may see here. With an oral medicines, with the Virechana, after an Virechana procedure, the pathyadi lepa has been given, the lepa was applied, and you may see the lesion, how the Switra lesion has been reduced. How the Switra lesion has been reduced, you may see in the figure. Last, the conclusion part. After the Virechanakarma, followed by pathyadi lepa in management of Kitipakushta has been studied clinically. It has given a good significant result in the symptoms of Kitipakushta. The effect of Lepa had given a good results in management of Kitipakushta after an Virechanakarma. Panchakarma is an ultimate tool for better maintenance of health and prevention and curing of diseases. Judicious, appropriate application of an Panchakarma could be the right way for all the forthcoming practitioners and to all the students and to all the scholars. Virechana is a particular, can be used as regular treatment modality for OPD basis patients. Many of the acute conditions can be treated by using Virechanakarma as a therapeutic procedure. Bibliography part, Agnivesh Charak Samhita elaborately explained in the Kushta chapter. You may see in the, as the reference have been, you are seeing on the screen, and the foreign books I have referred the Harshmorgan textbook of pathology and Davidson, and Yoga Ratnakara is one of the good reference which have been the Kushta Lepa, pathyadi Lepa has been taken, and these are all the references you may see on the screen. Thank you. And today I want to tell best thing is we the Ayurvedians are not lagging in any treatment. It's a science of an 5000 era before science. Everything is there. Not only the allopathic medicines, allopathic ointments, gels, jellies are there. There are the lepas. I want to tell you more on the lepas, and concentration about the lepas and application of the lepas and ointments are in such a way. The pathyadi lepa is also acting in a good way in all the skin disorders, in all the skin deformities. You may try this and you may adopt in your general practices.
Yes, well said, sir. Thank you for this informative session. I am sure each one of us have learnt a lot from this session and will definitely apply it in our practices. I would like to tell participants, those who have any queries can put their questions in the chat box. We are going to discuss them. For those who are new to this webinar, I would like to tell, to connect the students of Ayurveda all over the India, we have created a Telegram channel, that is Ayurvedic channel, the Indian Pathy. In that channel, we aim at daily quiz of UG as well as PG assignments, various Ayurvedic and modern books, PDF and study material for students in this lockdown period. Also, we share the links of various webinars like this and competition updates in our WhatsApp groups. We also support young talents who are ready to present webinars at such a platform. If anyone wants to be a part of our channel and family, you can contact us. The Telegram link and YouTube link, WhatsApp links are all given in the chat box. So, moving to the question answer round. The first question is from Dr. Roshan. Pathyadi Lep formulation.
Sir?
Yes, sir. So first question is Pathyadi Lep formulation.
It is there in the PPT presentation. It is there. The formulations and the drugs involved in it. Ingredient of a drug is, as I be giving it in PPT. It has been explained. You go through that. There is an ingredient of drug, the patya, or the haridra, and the vidanga, and the gomutra. These are all the ingredients in Saindhavravana, Bapuchi. These are all the Kushtara Primignara drugs, which is having a Vata Kapara dominant, Vata Kapara property.
Yes. Next question is from Dr. Abhinandan. Please tell me other than Pathyadi Lepa for skin disease.
There are so many drugs. But I have taken it because it's on my PG thesis I have taken. Hence I have been using from there only. It has a good result. You may go through classical part. There are so many applicants, so many lepas are there.
Next question is from Dr. Best. Sir, in case of Pittaj and Raktaj Vikar, which karma is best, Raktamokshan or Virechanakarma?
Depends on the doshas, depends on the dosha, depends on the patient. It may vary. Which is best?
Next question is from Dr. Kiran. Sir, is there any case where Shvitra flares up after the Virechan?
Shvitra?
Flares up after the Virechan.
Yes, I have been given so much of cases, it is relieved. The lesions are being reduced. With the oral medicines also, the Arabadidi Kashaya, the Tadrashta, the Mahamanjishta, the Kashaya, Pushtahara, Varna drugs, they are being used after Shodhana, we will get a good result.
Next question is from Dr. Siddhesh. Sir, is this leaf good for psoriasis, major skin disease?
Me?
Is it good for psoriasis?
Yes, it is good.
Next question is from Dr. Meghna. Sir, can you tell about the Sadhyo Virechana?
Sadhya Virechana is a subchapter where the dosha predominance is more, and hence the dosha condition, the dosha nirana is an emergency. When it is needed, then the Sadhya Virechana is done.
Next question is, does this work in varicose veins?
No, it does not work.
Next question is, how to decide to go with Shaman Aushadhi or Virechan?
All the Kushtara dravyas, all the Krimihara dravyas, even in the classical part, we should go through that, and with that drugs, the Shaman Aushadhi has been given and chosen. Depends on the doshas. Predominance of doshas, the drugs are chosen.
Next question is from Dr. Abhinandan. After Virechan, all skin disease will be recovered completely or it can reoccurring again?
If not, it depends on the completely depends on the dosha predominance. If not, puna shodhana is needed.
Yes, sir. So next question is from Dr. Kiran. Sir, Trivrit Lay is better or Ichha Bhedi Ras for the Virechan?
For Virechana, here I have been choosing the Trivrit Lay is better.
Okay, sir. So I think there is no more questions left.
Okay.
Yes, sir. In case of Sheet Pitta,
Okay.
someone is asking,